Good evening, everyone, and welcome to our webinar, Equine Worming in the 21st Century Facts and Fiction. We're just going to wait another minute and we'll kick off shortly. We're just waiting for some more attendees to join us. So we'll kick off in a minute's time. Thank you. All right, good evening, everyone, and welcome again to our webinar, Equine Worming in the 21st Century Facts and Fiction, hosted by Horseland and Verback Australia. Thank you for joining us. It's a real pleasure hosting everyone tonight, and we've got some great speakers lined up, including Dr. Tania Sundra, who you can see on the screen, and also Kelly May, who I'll introduce later. Before we begin, I'd like to go through a little bit of housekeeping so everyone is comfortable using the webinar platform tonight. Now, those who have logged in today, you should be able to see my presentation, which currently shows my mobile number. All participants except for myself and the presenters are currently on mute, just to ensure minimal background noise. On the right, you can see an image of your webinar control panel. If you can't see the full control panel, please click on the button shown inside the yellow circle, which will then expand out the full control panel. If you want my attention at any time throughout the webinar, you can also click on the little hand symbol circled in green. This will just alert me that you might require attention and I can find out what you need. Now, if you have any questions or would like to chat with me during the session, simply click on the questions tab circled in red. This tab will then drop down and you can type your question into the area shown by the red arrow. Remember, you can also text me through your questions. Please feel free to send in questions at any time throughout the session. If they're urgent, I'll reply immediately via chat or text. Otherwise, any questions asked will be put in the queue and answered after the presentation. All questions are anonymous, so please don't feel shy in asking any questions if they do pop up. And finally, today's presentation will be recorded and made available to the attendees. So that's all the housekeeping done. I'd like to kick on and remind everyone attending tonight that there are 4 $50 Horseland gift cards on offer as prizes tonight for attendees, which will draw towards the end of tonight's session. We also have an exclusive discount code to use on the Horseland website, which we'll send out afterwards. Before I introduce our first guest speaker, I'd like to find out a little bit more about everyone here tonight, so our presenters can better tailor their presentations. So I'm just about to launch a quick 3-question poll, which if you're on a laptop or computer, you can participate by selecting the answer that best applies to you. All right, so I'll just run the first poll question, which is, where are you joining us from this evening? Is it New South Wales ACT, Vic Tas, Queensland NT, WA, or South Australia? So if you can't select any of the answers, you can also type in your answer into the chat box. All right. I see most of you have voted, so I'll be closing the poll off in 5, 4, 3, 2, 1. Now I'll share the results on the screen. So we've got 34% joining us from New South Wales ACT, 28% from Vic Tas, 22% Queensland NT, 11% WA, and 5% South Australia. So welcome. Our next poll question is, how many horses do you own or have? Is it 1, 2, 3, 4, or 5 or more? All right, again, most of you have voted, so closing the poll off in 5, 4, 3, 2, 1. And again, I'll share the results on the screen. So we've got 18% of our audience tonight with 1 horse, 28% with 2 horses, 8% with 3 horses, 10% with 4 horses, and the majority, 36%, with 5 or more. And the final question before I introduce our first guest speaker is, How often do you deworm your horse? Is it once per year, twice per year, 3 times a year, 4 or more times a year, or never? All right. And closing the poll off in 5, 4, 3, 2, 1. And again, I'll share the results on the screen. So we've got 5% deworming once a year, 32% twice a year, 26% 3 times a year, 38% 4 or more times a year, and 0% never. All right, so we'll kick on, and I can introduce our first guest speaker for tonight. I'd like to introduce Dr. Tania Sundra. Tania graduated from Murdoch University in 2009 and completed an equine internship at a busy performance horse hospital in the USA. Upon returning home, she spent a few years working in racetrack and reproduction clinics in Western Australia. In 2015, Tania founded Avon Ridge Equine Veterinary Services, an ambulatory equine practice servicing Perth and surrounding regions. In 2019, she successfully completed examinations to become a member of the Australian and New Zealand College of Veterinary Scientists Equine Medicine chapter. Tania has a keen interest in all things related to equine medicine, particularly gastroenterology, endocrinology, and parasitology. We're very lucky to be joined by Tania, so please give her a warm welcome, and over to you.
Thanks very much for the introduction, David. And also thank you to Virbac and Horseland for giving me the opportunity to talk to you guys about worming your horses. It's certainly a topic that I'm really passionate about, and it's a conversation that I have with clients on a daily basis, if not several times a day. I think it's really important because worming is really something that affects every single horse, regardless of their age, regardless of their breed, regardless of what you use your horse for. You may have just a couple of, Shetland ponies or little lawnmowers in your backyard, or you might have a 3-star eventer, or you might own a thoroughbred stud. Well, the principles of really 21st century worming apply to all those groups. So hopefully everyone will get something out of this talk today. So one point that I really want to get across is that your horse is full of parasites. We have to live and accept that. Parasites aren't these big, nasty, horrible things that you may have thought in the past. There's actually evidence in other species to say that your horse's immune system is actually stimulated by parasites. And over the years, we've really tried and failed to eliminate parasites. So we shouldn't be trying to get rid of them altogether, but rather reduce them to a safe level to prevent disease. And I know when, you guys check your horse's manure, you might see these, horrible white worms or little red squiggly worms in them. And they are pretty gross. But if I give you another analogy, and I stole this from another parasitologist, so I won't take credit for it, but he often tells clients that, your horses are full of bacteria. There's millions of bacteria within your horse. And you wouldn't go to your doctor and ask them, or your vet and ask them to prescribe an antibiotic for you every 3 months or every 6 months to get rid of all that bacteria. The bacteria is actually there for, a lot of useful purposes in your horse's digestive system. And it's only when you get that bacteria out of balance that it causes an issue. So the same thing applies to parasites. We don't really want to get rid of them completely, but we want to reduce the risk of your horse having any sort of parasite-related disease. Why do we need to do this? Well, change is largely overdue. Our current worming practices stem from the 1950s or 60s, where we looked to eliminate parasites altogether. And like I just said, this isn't what we're trying to do. And you know what, your horse still has parasites in them. So clearly a lot of these practices have been largely ineffective. A lot of them have been based on calendar or interval worming, where, you guys have probably seen things around where every 6 weeks or every 8 weeks, they recommend that you rotate through wormers change them, give them a different wormer. Well, that's also something that we don't want to do. What this does is it results in resistance, which we'll come to talk about shortly. It fails to eliminate the parasites again. It wastes your money. And there's also, well-documented evidence of some significant environmental consequences that will result from overworming your horses. There was a recent study that was presented showing that dung beetles especially are really affected by the overuse of dewormers. And I'm sure Verbac will probably be able to provide you with some links to that study for anyone that's interested. So we should also bear in mind that there's 3 classes of wormers that are available. They've been around, for 60, 70 years. And unfortunately, there's no new wormers available on the horizon for horses. So we really need to preserve the ones we have. The newest class of wormers that we have, which are your mectins, well, they've been around for 40 years. So, they're still not that new. And unfortunately, even though a lot of scientists have tried to come up with new classes of wormers for horses, they've all been shown to be largely ineffective. So we're stuck with what we've got, and we need to make sure we preserve them for the future. So what is resistance? Well, through the process of evolution, the worms inside your horse have evolved to a point now where they're able to survive a worming treatment that was previously effective in killing them. It's not a concept that, just relates to parasites. Humans have obviously evolved, other species undergo evolution, bacteria and viruses all evolve. So, but really, what does that mean for your horse in particular? Well, inside your horse, you've got these, what's called susceptible worms, and these are the little squiggly ones in blue. And you've also got resistant worms, which are the ones in yellow. So the susceptible worms are the ones that when you worm your horse, they're going to die off. The resistant worms, they're the ones that are still going to hang around because they basically look at the wormer and go, yeah, great, we're still here, we've evolved, you're not going to kill us. So when you give your horse a wormer, you kill all those blue susceptible worms, and what's left behind are those yellow resistant worms. Those resistant worms then go on to reproduce, and they create more resistant worms inside your horse. And the more you worm, the quicker resistant develops. So remember we said that resistant worms can't be killed by worming treatments? Well, we hope this isn't going to happen, but this is one thing that really concerns veterinarians a lot, is that, like I said, there's no new classes of wormers available. So if your horse has a large number of resistant worms and then suffers some sort of parasite-related disease or colic, well, unfortunately, we're going to be out of options in ways that we can treat your horse. So this is a situation where no vet and no horse owner wants to see. So there's what we're going to talk about today will hopefully give you guys some practices that you can implement from today that will prevent this from happening in your horse. So like I said, there are certain habits that we've been involved with over the last few decades that actually promote the development of resistance. And this includes worming too frequently, repeatedly using the same wormer. You may think that that's not what you're doing because you grab a new wormer off the shelf every time you're at a feed store or a tack shop. Well, like I said, there's really only 3 classes of wormers. So even if you're buying different brands of wormers, doesn't mean you've changed the wormer that you're giving your horse. They're largely going to be from the same class. Underdosing horses also speeds up the development of resistance. So getting an accurate weight on your horse. Verbac have got these fantastic weight tapes that you'll probably be able to grab from Horseland next time you're there, or even your feed shops. So the other thing that's important to know is that once resistance is present, it cannot be reversed. And this is a really scary concept because they've shown that if you have resistant parasites in your horse, you cannot deworm them for 10 years and you still won't reverse that resistance. Once you have it, it's there to stay. And that means that the wormers are going to be largely ineffective. There's going to be a greater selection pressure on maybe some other wormers that are out there. And you're also going to lead to a greater risk of disease. So what my clients are now doing, and I think what a lot of proactive horse owners around Australia and around the world are really now doing, is embracing what's called diagnostic-driven deworming. Now, what does this mean? Is that, well, we use diagnostics, largely fecal egg counts, which we'll come to talk about shortly, to look at what worms your horse has, look at how many eggs your horse is shedding, and determine which ones we're going to treat. So which horses we're going to treat, I mean. So what this does is it maintains what's called refugia. And this is a population of worms that have not been exposed to the worming treatment. So by maintaining that refugia, if you think back to those blue worms, those will actually dilute out the population of resistant worms to try to thin them out. So this largely will help prevent resistance, minimises the use and reliance on wormers, so you can reduce the amount of chemicals you're giving your horse, and also avoids repeated use of the same wormer. So the main premise of this is that it's largely based on what's called the 80-20 rule that some of you may have already heard of before. So this is where 20% of horses shed 80% of parasite eggs onto pasture. This is a rule that applies to horses all over the world, regardless of where you live, regardless of how you manage your horses. But how do we know which horse is actually shedding most of the parasite eggs? You can't tell, right? You can't look at a horse and go, is it the fat one over there? Or is it the little Shetland pony? Or is it the skinny thoroughbred? You just don't know. There's no way of knowing by looking. The only way we can tell is to perform a fecal egg count. So with this, we take a sample of manure, you send it off to a lab or give it to your vet, who will then look at it put it on a slide and look at it under a microscope. And what this will tell you is it'll identify the horses who are shedding the most amount of parasite eggs onto pasture. It does not reflect the individual worm burden of the horse. And this is something that's really important. Just because your horse comes back with an egg count of 1,000 doesn't mean that it has a super high worm burden at all. It just reflects how many eggs your horse is shedding onto pasture. And it looks for basically two types of parasites: ascarids, which are also called roundworms in Australia, and also strongyles. So those are the two main ones that you can see under a fecal egg count. So once you get your results back, if you've got 5 horses, 1 horse will be the high shedder. The other 4 will be the low shedders. So we're not going to treat the low shedders. We're going to deworm the high shedder. And this is basically the premise of diagnostic-driven deworming. So if we look at this graph here, and this is some data that's just from a lab that shows, the egg counts of horses that from samples that have been submitted to the lab. And you can see the majority of horses sit in that 0 to 100, so really low. Now, we've previously used the cutoff of anything over 200 required deworming, but really recently, a lot of experts now recommend that a cutoff of 500 or 600 is more appropriate to determine whether or not horses need deworming. And even when we've moved that cutoff up to 500, you can still see that more than 8 out of 10 horse wormers are actually given unnecessarily. And by doing fecal egg counts, we can really target the ones that do need it and give it to those and spare those ones that are less than 500. So in 2020, there was a study performed by Martin Nielsen where they demonstrated that there was no negative health effects of actually reducing the frequency of deworming. And they looked at a number of health parameters in these horses where they reduced deworming. They found that there was no adverse effects at all. So again, that paper, there's a reference there. If you guys want to look that up for more details, feel free to. So one of the other important factors to consider is knowing your horse's risk. Everybody wants us to come along and just say, look, just give me a plan. How much, when do I need to deworm my horse? Tell me what I need to deworm with and I'll do it. Well, that's not as simple as that, unfortunately, because different horses are going to be classified into different risks and there's no one size fits all program. They might be a low risk, a moderate risk or a high risk. And this, along with fecal egg counts, are going to determine if deworming is actually necessary. So low risk horse are the ones that typically return low fecal egg counts. They're middle age, so between 5 to 15 years old. They live in a closed herd. There's not a lot of horses coming and going from the property. Or if they are, there's very good quarantine processes in place. Pasture management is excellent. Manure is picked up regularly. And there's no history of colic or parasite-related disease. So hopefully everybody that's listening, hopefully your horses fall into this category. So these horses, you know, you chat to your vet about this, and I'll explain this a little bit more in detail, but majority of these horses really only need deworming once a year. Now, the high risk group, these are the ones that return high fecal egg counts. They may be young horses, or they may be co-grazing with young horses. And we know that a lot of young horses are, you know, their immune system isn't as well developed, so they tend to shed a large amount of parasite eggs onto your pasture. And this will be further increasing the risk of transmitting parasites throughout your herd. So if you have a high stocking density as well, that puts them in a high risk. If there's poor pasture management, you can see by this picture here, I don't know when the last time manure was removed from this paddock. And there may also be a history of colic or parasite-related disease on the property. So again, your vets are going to be the best people to talk to about this, because they have an intricate knowledge of your property, how you manage your horses, and they'll be able to guide you with whether or not you fall into that low or higher risk category. So like I said, the basic premise is fecal egg counts, and we recommend sort of 3 to 4 fecal egg counts per year. This will help identify which horse is shedding the most amount of parasite eggs onto pasture over a 12-month period. And we know that if you've got a stable herd and management changes haven't really changed, then you know you can perform these 3 to 4 fecal egg counts, and it's going to be that one horse is going to be pretty much the consistent horse that sheds the most amount of eggs onto your pasture year in and year out. So for the low shedders, again, like I said, deworm once a year, and discuss with your vet the need for moxidectin. This might be a little bit controversial, but it's certainly my view that I don't think that every horse needs moxidectin every year. I think some you might be able to get away with giving it to them every 2 years, and ivermectin alone may be sufficient yearly. But again, that's a bit of a controversial stance. So chat to your vet about it. Discuss how you manage horses on your property and what your risk for disease might be. And this here is, I have a lot of vet students with me, and this is Chris, a vet student who's having a chat to an owner about how she manages her horses. So it's something that, you know, certainly at university level, vet students are now being told to engage with owners a lot more into this diagnostic-driven deworming plan. So if you're moderate or high-risk shedders, they need deworming 2 to 3 times per year. Like I said, these are the guys that you may be grazing with young horses. They may be really high stocking densities and have a lot of horses coming and going from the property. So moxidectin should be given once a year to these guys, because their risk for parasite-related disease is going to be higher. So this is probably the most important use of a fecal egg count to determine if the wormers are actually working in your horse. And the way you can do this is perform what's called a fecal egg count reduction test. So what does this mean? Well, we basically perform a fecal egg count on your horse. If it's come up sort of over 500, we'll advise, this is what I advise my clients, we'll deworm their horse with a particular dewormer. We then perform another fecal egg count 14 days after deworming. Now, when you do this, definitely talk to your vets about this, because we've got thresholds depending on the wormer that you've used, what sort of level of reduction you'll need in order to categorize resistance or show that the wormer is still effective. So if there isn't a suitable reduction in the egg counts, then it shows that you have resistance to that class of dewormer on your property. And this is really important. I think every horse property should do this once a year on a particular class of wormer to just see whether or not that wormer is going to be effective or not. So I'm going to switch gears a little bit here, because I know some of you guys have foals and you want to know what to do about your foals. Well, they're really different to adult horses. They need their first dewormer no earlier than 8 weeks of age, and they need a dewormer that targets ascarids. Now, ascarids are these pretty big white worms, long worms that you can see here. Hopefully no one's having their dinner whilst watching this. Apologies if you are. I think that's the grossest picture I've got throughout all of this. So look away and you'll be able to look back in 30 seconds or so. So these worms sit in the small intestine of your horse and can cause small intestinal impaction, which can be quite significant. So we want to target these ascarids, but unfortunately, due to the overuse of wormers, there's resistance of ascarids to your mectin dewormers. So these are your ivermectin, moxidectin, abamectin products. And so if you give your foal at 8 weeks of age a mectin wormer, it's going to not be effective for the treatment of ascarids. What we want instead is to use a benzimidazole dewormer or a BZ wormer, which will kill these ascarids. Then at weaning, you want to perform a fecal egg count and then a fecal egg count every 3 months after that. And that'll help you determine whether or not you're treating for these ascarids or strongyles. So whilst strongyles can be killed by mectins, there's a lot of resistance to strongyles to the BZ wormer. So really, without a fecal egg count, you're not going to know what wormer you need to use in your foals. Quarantine deworming. This is a question I get asked a lot in my clients that have busy agistment centres. So these are the recommendations I give them. So new arrivals, we should be isolated from the herd for a minimum of 2 weeks. And this isn't just for parasites. This is also for other diseases like respiratory tract diseases, which, if you brought a highly contagious horse into your property, that will spread like wildfire on a busy agistment centre. So quarantine them away from the herd for 2 weeks. A wormer containing moxidectin should be administered on arrival. If they are less than 5 years old and we are worried about ascarids, then they should also be dewormed with BZ wormer as well as moxidectin. But there's absolutely no need for adult horses over 5 years old where there's no risks of ascarid disease to need to be given a BZ wormer at this time. All manure should also be collected and composted away from the grazing areas. Again, don't quarantine these guys and then pick their manure up and spread it over grazing areas. You'll just spread any resistant parasites they have brought in with them onto your property. So pasture management, this is something that people tend to roll their eyes about when I start talking about it. So hopefully you guys are still with us here. This is a really, really, really important factor for parasite management. I can't stress it enough, but in another couple of slides, you'll see why. So what we recommend is basically maintain reasonable stocking levels. You don't want to, high stocking density increases a lot of manure on your paddocks, which is going to increase your transmission risk of disease. Separate your horses into age groups. Like I said, young horses have a bit of a lower immunity, so then they tend to be the one excreting the largest number of parasite eggs onto your pasture. Yearlings especially probably wouldn't be uncommon for them to have egg counts into the thousands. They're high, but it's pretty common for this age group. So keep them together and keep them separate from your older horses. So keep your horse groups consistent. Avoid these dose and move strategies. Poo pick twice weekly. Really, really, really important. Rotational grazing is also an excellent tool which allows you to rest your pastures. Co-grazing with ruminants helps to break the parasite life cycle, which is also important. And again, don't spread manure onto your pasture, because all you're doing is just spreading the infective larvae all over your grazing areas, which are likely going to contaminate your horse. So don't take my word for it about poo picking. This was a study that was performed in Newmarket, where they looked at the different strategies to actually reduce the amount of larvae on pasture. So you can see here where there's no measures in place, you have really high levels of manure, almost 20,000 larvae. If you gave a BZ wormer every 4 weeks, which this study was performed a number of years ago, so hopefully nobody is doing that anymore, that reduced it to 10,000. Ivermectin every 8 weeks, again, hopefully after listening to this talk, nobody's going to do that anymore. That still had levels of about 5,000, but twice weekly poo picking with reduced levels down to 1,000. So For anyone needing extra motivation to get out there with the pooper scooper, it's not only fantastic exercise, it's also going to reduce your reliance on wormers and probably save you money in the long run. So some take-home messages. We know that current worming practices are unsustainable and we need to change them. Resistance to wormers is increasing. Once we have resistance, it's irreversible. So we need to reduce the wormers that we use the correct dose, and really importantly, take care of our pasture. Talk to your vet about a diagnostic-driven deworming plan that works for you. And this basically starts with fecal egg counts. If you're not sure of where to start, talk to your vet about, looking at how effective the wormers that you're using are on your property. So do one of those reduction tests. And I think you might be surprised at the fact that, on most properties in Australia now, you're going to have resistance to one, if not two classes out of 3 dewormers that are available. And there's even emerging resistance now in Australia that we've got possibly resistance to ivermectin too. We know that in ascarids there's resistance to it, but there's emerging resistance to strong gall parasites as well. Remember, there's no one right way, but if we want to prevent sort of parasite-related disease in our horses, then we really need to start thinking about the way that we're worming them and reduce our reliance on wormers and start embracing diagnostics. All right, so thank you. Feel free to fire any questions that you might have.
Thanks so much, Tania, for your presentation. Now, if you do have any questions that you would like to ask Dr. Tania, please type them into the chat box and we can add it to the queue to be answered during the Q&A section. Now, before our second speaker for the evening, I'd just like to run a few more poll questions. So I'll launch them now. So the next poll question is, which product did you last use to deworm your horse? Is it Equimax, Equimax Elevation, Strategy T, Equest plus Tape, or another product? Remember, you can also type in your answers if you can't click on the right response. All right, most people have answered, so I'll close the poll off in 5, 4, 3, 2, 1. And I'll share those results on the screen. So we've got 21% having used Equimax as the last dewormer, 5% using Equimax Elevation, 22% using Strategy T, 33% using Equest plus Tape, and 18% other. And our next poll question is, how often do you perform fecal egg counts on your property? Is it once a year, twice a year, 3 times a year, 4 or more times a year, or never? Some really great participation. So closing this poll off in 5, 4, 3, 2, 1. And I'll share those results on the screen again. So we've got 14% of the audience tonight performing fecal egg counts once a year, 16% twice a year, 11% 3 times a year, 9% 4 or more times a year, and 49% never. And the final question for tonight is, have you had to perform a fecal egg count reduction test on your property in the last 12 months? Yes or no? All right, and closing this one off in 5, 4, 3, 2, 1. So thanks everyone for participating in the polls tonight. I'll share the last results on the screen. So we've got 16% having performed a fecal egg count reduction test in the last 12 months, and the majority, 84%, no. All right, thank you so much again, and I will get back into the presentation. So I'd like to introduce our next guest speaker, Kelly May. Kelly is the area sales manager for Equine in Eastern Victoria and is a passionate and avid horse owner herself. Tonight she'll be complementing Tania's presentation by discussing the different types of horse dewormers on the market and touching on points around strategic deworming practices. It gives me great pleasure to introduce Kelly tonight. Welcome, and over to you.
Thanks for the introduction, Dave. As Dave said, my name is Kelly May and I'm an area sales manager for Virbac. I am an avid horse rider and compete on my own horse. I have 2 kids that go to Pony Club and they compete as well, and I grew up on a thoroughbred stud, so I guess you could say that my life is horses and horse health. So I've been given the great task tonight to have a chat to you about what the current Virbac worming recommendations are, have a chat to you about our gold standard, talk about what's in the products that you're using and when you should be using those, and also, I guess by the end, hopefully give you a great understanding of how to minimize parasite risks on your horses. So let's get into the fun stuff. So why have a strategic gold standard worming program? The truth is that we're never going to completely eradicate parasites in horses. So what we need to do is we need to try and minimize the risk of parasite-related disease. Simply, there are no new products or ingredients that are in development anywhere that will completely take them away. So as Tania pointed out, we need to start putting together programs and worming programs for individual horses that incorporate their fecal egg counts, their resistance status, and also their environment. And as a guide, again, Tania's already spoken about, but as a guide, we should start looking at the current recommendations for adult horses and young horses. So when we're looking at current recommendations for adult horses, we want you to perform 3 to 4 fecal egg counts per year to determine the shedding status of the horse. So and once you've got that, you'd work with your veterinarian to determine your horse's risk for parasite-related disease and appropriate worming program for your horse. You should also be conducting fecal egg count reduction tests to make sure that you check for resistance and also that your worming program is actually working for you. And then on top of that, you treat once per year with an effective all-wormer. So you'd use Strategy T, Equimax Elevation, or a moxidectin-based product. For young horses, so we're looking at horses from when they're born, and you'd always start worming them from about 2 to 3 months old. And your first worm would be with Strategy T because of the time of year. And then moving on from there, you do 4 to 6 months for the second worming, and that would be with Equimax Elevation. And then from weaning, conduct fecal egg counts every 3 months to facilitate a treatment program for them. When you're looking at yearlings, you'd administer an all-wormer, for example, Equimax Elevation or Strategy T once or twice a year based on fecal egg count results, and also check that there aren't encysted cyathostomes that are a concern. If there were, you would use a moxidectin-based wormer instead. So now that we've been through the current recommendations, let's have a chat about what's in the product. So knowing what's in your product. There are 4 main active ingredients that we talk about. So mLs or mectins, which is avermectin, so avermectin and ivermectin. You've got milbemycin, moxidectin. You've got BZs, which end in azole, so oxfendazole, oxybendazole, and fenbendazole. Then you've got tetrahydropyrimidines, THPs, which are pyrantel and morantel, and isoquinolines, which is praziquantel only. When we talk about the different ingredients and how they work, hopefully it will give you an understanding of what you should be looking at when you go into a store or order wormers, and what you should be looking for that's actually in the products. So firstly, we'll chat about mectins or mLs. So mectins are the most commonly used products out there, and they're very useful in control of a wide range of parasites, but they're not useful against tapeworms. Roundworm also has quite a large resistance to mectins on their own. So when we're looking at roundworm, which is in young horses, we need to make sure that we are using a combination, so not just mectin on its own. Adult horses as well have developed some kind of resistance to mectins as well, because they have been overused a lot. So again, we need to make sure that we're strategically using other chemicals with mectins for adult horses. When we look at BZs, they treat the majority of species but have no efficacy on tapeworm, and they also have no efficacy on bots. Small strongyles have also become resistant to BZs when used on their own. Again, when you use them in combination with other ingredients, they are much more effective. With your THPs, they treat the majority of worm species, including some tapeworm, but have no efficacy on bots. It's essential when looking at young horses, so under the age of 2, that you use a combination of THP and BZs in your program, because once again, they're not reliable on their own, and mectin's not reliable to treat roundworms. So we need to be using it in combination. So products like Equimax Elevation and Strategy T do have combinations in them that are really effective for young horses. Next, you've got your isoquinolines, which is praziquantel. Praziquantel is the only ingredient that's effective on is 100% effective on tape. So we always make sure that when we're worming for tapeworm, that we make sure that it's got praziquantel in the active ingredients. What should I use and when? It's important that what we're looking at of what to use and when, that we consider the variables, because you need to know what you're treating for and what the horse, information on that horse. And as we said earlier, that we need to be putting together targeted individual programs for each horses. So a couple of questions that you would ask yourself: how old is the horse? Is it a young horse that needs to be treated against roundworm? What's the current climate where I live? Do I need to be treating for bots? Have I wormed against tape this year? What does the fecal egg count say? Has my horse ever shown resistance before when doing a fecal egg count reduction test? So we need to think about what the variables are and what the best way to treat them, would be. A really simple thing to treat with, and an easy way, is to look at combination wormers. Combination wormers are when you've got 2 or more active ingredients that target the same parasite. So targeting the same susceptible parasite. The products that you would use to do that would be Equimax Elevation or Strategy T. When we talked about the ingredients, we chatted about the fact that THPs and BZs don't treat bots. So you wouldn't use Strategy T, for instance, to treat bots with. You'd use Equimax Elevation or straight Equimax. So hopefully when using a combination wormer, it just makes it a little bit more simple for you, I guess. We've also identified within the Virbac worming range what we consider to be gold standard, so the best strategy. And those products are Equimax, Equimax Elevation, and Strategy T, because they're a really good all year round strategy that you can use with your horses. Our other products include Aeroquel, Equimax LV, and also Razor as well. And we'll go through all of those individual products now to hopefully give you an understanding again of what you're looking at when you walk into a store and what products you should be looking at to choose. So first up, we've got Equimax. Equimax is a broad spectrum oilwormer and it's effective on all susceptible equine parasites, including all 3 species of tapeworm and all 3 species of bot. And it contains abamectin and praziquantel and treats horses for up to 700 kilos. Next, we've got Equimax Elevation. Equimax Elevation is a broad spectrum combination wormer, which is effective on all susceptible equine internal parasites, including all 3 species of tape, all 3 species of bot, and it contains pyrantel, ivermectin, and praziquantel, and is also registered to treat abamectin, moxidectin, and ivermectin resistant roundworms that are found in young horses. Again, it treats up to 700 kilos. Next, you've got Strategy T. Strategy T is a broad spectrum non-mectin combination wormer that's effective on all susceptible equine parasites, including tapeworms. It's the ideal first wormer for foals, as usually it's used in summer or in warmer climates. And the other thing you'd use it for is if you knew that there was a mectin resistance or where mectins have been overused. Again, because it's got oxfendazole and pyrantel, it's not usable against bots. So we don't use that in the months where we're actually trying to target bots. Next, you've got Aeroquel. Aeroquel is great for horses that are hard to worm, as it comes in a simple pellet formula, and you just add it to the horse's feed. It covers up to 700 kilos and it contains ivermectin. Then you've got Equimax LV. Equimax LV has all the benefits of Equimax in a concentrated multi-dose syringe containing ivermectin and praziquantel. It's great if you've got small hands because it is a smaller tube, and that treats horses for up to 700 kilos. Then you've got Razor. Razor, again, broad spectrum protection in a concentrated multi-dose syringe containing ivermectin and praziquantel. And it has 2 doses in it for 2 600 kilo horses. So it's really handy if you do have horses that you know are, if you do have multiple horses. So it can just be a simpler way to do it and more cost effective. So we've been through the current recommendations, we've been through the different ingredients, so the 4 major ingredients that we have in wormers or dewormers, and we've also discussed what the products are that you would use and when you'd use them. The most effective program out there is a program that is tailored to your horse. And we need to make sure that we're using fecal egg counts, as we've discussed, that Tania's discussed, and doing those as much as possible, and using a targeting worming program. We need to make sure that we avoid using the same chemicals from the same class. We need to make sure that we're treating young horses effectively and treating against roundworm effectively. Also looking at horses' worm life cycles, so the parasite life cycles, and treating them effectively at the right time, and also avoid using single active ingredients. There's also, all of that in combination with making sure that you have good pasture management, making sure that you're dosing your horse correctly, making sure that you have an effective program and your horse's resistance status, are all going to be things that are going to help you to tailor a program individually for your horse. And that brings me to the end of my presentation. I'm sure that there might be some questions afterwards, but I will throw back to you, Dave.
Thank you, Kelly, for your presentation and for giving us a glimpse into strategic equine deworming. We're actually into the final part of the night, which is the Q&A section. So yeah, if you have any questions for Dr. Tania or Kelly, please send them through. There's already plenty so far. And if we don't get to your question tonight, we will come back to you via email. So the first question for the night is for Tania. Actually, I'll just invite Tania and Kelly back. Let me know if you guys are here.
Yep.
Back. Hi, Tania. No worries. Put my camera on too. So the first question is for you. So interested to know what worming programs you recommend for foals. I know you mentioned it in your presentation, but could you give everyone again just a quick breakdown and summary?
Yep. So the very first wormer should really be given somewhere around sort of the 8 to 12 week period for your foals. And like Kelly mentioned, that really it's roundworms that we're wanting to target in foals. So your BZ wormers like Strategy T would be the first wormer we'd give your foal at that time. There's no real need to worm them any earlier than that because it's unlikely that there's going to be many parasites there to begin with, or they're really at the right stage that we'd be treating. So first wormer, 8 to 12 weeks, do a fecal egg count 3 months after that to determine whether or not you're looking at ascarids or strongyles, and that'll determine what wormer to use. And then every 3 months after that to do a fecal egg count as well.
Excellent. Thanks so much. The next question also for you. How long should pastures be spelled for when rotating paddocks?
That's a really good question. Again, there's no hard and fast rule. It really depends on climate, where you are in different parts of Australia, what the time of year is, what the rainfall's like. So I can only really speak from WA, from a WA perspective. I know other parts of the world and other parts of the country have very different climates, but over sort of a hot, dry summer that we typically have in WA, generally 4 weeks or so. There's not going to be a lot of parasite transmission over that period because the parasite eggs are pretty susceptible to hot, dry weather. But if you were looking at kind of humid weather with lots of rainfall, or you're on irrigated pasture, then it's really the window for spelling is quite a lot longer than that too. So I think, yeah, you've got to take into account the different climatic conditions when you're wondering how long to rest pasture. But the main thing is pick up manure from your paddocks as best as you can, and don't spread manure through your paddocks with harrowing or manure spreaders either. So.
Excellent. Thank you so much for that. Next question, also for you. If a horse is a low shedder, do you need to still FEC 4 times a year, or what's your recommendation around that?
Yeah, that's a really good question. I get that quite a lot because a lot of people have low shedding horses. So we generally recommend over the period of 12 months, so generally over all the seasons, that you get 4 fecal egg counts in the very first year. If it's an adult horse, so between sort of 5 to 15 years old, and you're not taking them off the property, their management hasn't changed dramatically, you haven't got a lot of new horses coming and going, then that horse is probably going to be a low shedder for the rest of its life. So what I'd recommend then is to still perform a fecal egg count once a year, but potentially do that to test the effectiveness of your wormers on your property.
Excellent. Thanks so much for that. And sticking with the fecal egg counts, can they indicate what type of wormer should be used, the results?
Yes and no. When we're thinking about what parasites we're wanting to target, that really is important for foals. Like I said, you want to know if they're shedding ascarids or strongyles to know which wormers you want to use. So when they've got, a large number of ascarids being shed, you want to stay away from the Mectin group because they're largely ineffective in Australia and most parts of the world, and focus on your BZ wormers. Whereas if they are shedding strongyles, then certainly you'd want to use an ivermectin based dewormer. But for adult horses, it's like I said, fecal egg count is not an indication of the worm burden in the horse. It's really an indication of what horse is shedding the most amount of parasite eggs onto your pasture. So it's in a way, yes, if you're dealing with young horses, but there's a problem without having a two-way conversation with people. So my answers are pretty general. But as a whole, no, it's not going to give you, for adult horses, exactly what wormer to use.
All right, thanks for that. And just on, I guess, treatment, we've got a question around what about Panacur? Is it more or less effective than moxidectin and ivermectin?
Do you want me to take that, Kelly? Okay, so Panacur, the active ingredient in that is fenbendazole, and we've shown that a lot of people use that in sort of a 5-day treatment regime. The person asking this question has compared it to moxidectin, so I'm guessing that they're asking it in relation to the treatment of larval cythostomes. And it really depends what the resistance status is on your property. So if you have resistance to oxfendazole on your property with 2 strongyles, then 1 day isn't going to be effective, and it means 5 days of treatment sure as hell isn't going to do anything either. So it does tend to lead to a bit of more inflammatory response as well within the horse using it over 5 days. So that practice has really largely fallen out of favour I know amongst most vets that I talk to, and certainly some parasitologists, that no one really recommends the 5 days of panicure anymore.
Yep, no worries. Thanks, Tania. So the next question is a bit of a scenario. I have 6 critters aged 12 to 39. The older 2 mares, 36 and 39, never seem to have grain in their poop, only a little, whereas the 3 geldings and 1 big mare always have heaps of undigested grain. Is this a worm thing or more of just my abnormal horses?
Well, firstly, congratulations on having some nice old horses there. You obviously look after your horses really well to get them to that age. The undigested grain thing it's an interesting question. I think if you have a lot of undigested or particles within the manure that are, you know, quite long, anything over than about 1 centimetre or 1.5 centimetres long, I'd be looking for dental disease issues where potentially they're not chewing their food adequately, and so you're not getting as much of an absorptive capacity through the intestines. So probably not. I wouldn't say it's got anything to do with parasites. I'd say talk to your dentist and someone who looks in horses' mouths a lot more frequently than I do.
Excellent. Thanks so much, Tania. Question for Kelly. In terms of the wormers that you spoke about, are there any toxic levels of any of that, or specific levels that you shouldn't give?
Okay, so our wormers go up to 700 kilos, and that's what they are recommended for. So you wouldn't go over that if that's what they're referring to, as in toxic levels, or?
Yeah, probably over the threshold levels, I guess.
Yeah, we don't like to go over the threshold, no. So we like to keep it to exactly what is on the packaging and what the product is registered for.
Thanks, Kelly. And I guess this one is just about bots control. What do you recommend for that, Kelly?
Bots you would use Mectins. So that's why we always suggest that you do use a Mectin as well in your worming program, because bots are Mectins are the most effective at treating bots.
Yeah.
Can I jump in on that one?
Yes, absolutely.
So there is some evidence out there as well to show that moxidectin is not as effective as ivermectin in the treatment of bot larvae. Ivermectin's only got about 60% efficacy against the 3rd stage larvae of bots. But the main question I have is, or the main issue I have is that bots rarely cause any level of clinical disease in horses. And if it's bots that you're worried about, you should probably be thinking a little bit more about some other parasites, and be basing your worming strategies around other important parasites and other fecal egg count and what you see in a fecal egg count, rather than having, you know, I do a lot of gastroscopies, and, you know, quite often we see 2 or 3 bots and it freaks people out, but really they don't cause any issues in small numbers. In large numbers they look really, really gross, but really they don't cause any sort of clinical disease. So I wouldn't be rushing to give your horse a dewormer just based on a few bot larvae.
Excellent. Thanks so much, Tania. Look, we're running short on time, but there are a lot of questions. So I'm just going to go through 5 more questions, if that's okay with you, Tania and Kelly. Yep. So the first one is, look, if you just worm once a year, when is the best time to worm? I'll hand that over to you, Tania.
That's also a really good question. Again, it's based on seasonality and what it is you're wanting to treat. If you are deworming once a year, generally, as a very, very, very general rule, and I hate giving general recommendations, but generally in spring tends to be when I'd recommend the use of either ivermectin or moxidectin in horses if you're worming them for once a year.
Excellent. Thanks so much, Tania. And this question is a little bit about rotational worming. So would you recommend a seasonal approach to worming? So for example, a BZ combo in spring and summer, and then a moxi ivermectin in autumn and winter, or a long rotational worming program where you use one active class each year?
I certainly wouldn't recommend any sort of rotational worming. I know it's kind of something that's been in people's minds for a number of years, where we've been told to rotate through different dewormers, but we know that that process is largely ineffective and will speed up the development of resistance in your horse. So if you're wondering where to start, you know, there's no one size fits all program, and really just start with talking to your vet about performing some fecal egg counts to determine which horse you need to worm. And, you know, rotational worming doesn't really factor into, you know, 21st century worming anymore, but fecal egg counts certainly do. So we need to shift the conversation away from products and what wormers to use when, to what horse actually needs deworming, and what practices are actually going to reduce the risk of parasite-related disease.
Thanks so much, Tania. And this question, either of you could answer. How important is the use by date in terms of the products?
It's yours, Kelly.
You wouldn't use a product past its use by date. It's the same with any kind of product that you would use. The use by date is there for a reason, and that's when the product is its most effective. So that's when it's at its highest efficacy, and that's how long we know that that its shelf life is for. So you definitely wouldn't use it after its expiry.
Excellent, thanks so much. Another scenario question, and our second last question for the night. My 6 horses are on 20 acres split into 2 paddocks. Would you still recommend picking up manure? Tania?
Yes, I would, because I'm a stickler for that. But, you know, it sounds like 6 horses, so you've got 3 horses in 10-acre paddocks each. I guess the risk is going to be a little bit lower, but it really depends on, you know, what sort of climate you're in. Are your pastures irrigated? Are they dry sort of bush paddocks? There's a lot of different factors in there, but when in doubt, I certainly would recommend poo picking, because it's a really, really simple thing to do that everyone can do. That's just going to reduce your reliance on wormers and the need to deworm your horse.
Yeah, excellent. Thanks so much. And the last question tonight, I guess a lot of people are asking about resources for information, especially around fecal egg counts and dosing. Any recommendations on where they could go? I know Virbac has a great website. Kelly or Tania?
Yeah, the Virbac website. I'll also give my clinic Facebook page a bit of a plug. If anybody wants to follow us, we do some posts. If you go to our website, we've got some information there about fecal egg counts too. But Virbac certainly, you know, we've been involved in updating a lot of their resources in recent times, so there should be some good things coming up. But your vet's also a really good source of advice. You know, most vets want to engage and want to chat to owners about this sort of stuff, that people don't always think that to go to their vets and talk to them about it, but they're probably the best people to talk to, because they know, you know, the medical history of your horse, and there might be little nuances there that they might say, look, that's going to place your horse in a slightly higher risk. We should approach deworming this way in your herd.
And any general information that people are after when they go to our website, you simply go on to Horse Health Hub, which is you know, an icon on the website, and it will take you through to the worming section. And as we spoke before, there's a series of questions that it asks you to determine what risk your horse would be. So it's a great place to start there, and obviously have a chat to your vet, as Tania said.
Excellent. Thanks so much, Tania and Kelly. So unfortunately, it's time to wrap up the webinar. If anyone does have any more questions after tonight, please don't hesitate to send them through to us, and we'll get you in touch with the Virbac representative. Remember that this webinar has been recorded and will be made available shortly. Now, before we finish, we do have some lucky door prizes to give away. The lucky winners for tonight are Deborah Hyde, Linda Lycollett, and Natalie Smith. And I did say there were 4 gift cards available, and the last one will actually go to one lucky person who completes our quick 30-second survey that will come up when the webinar ends. Now, if you do have time, please complete it and answer the couple of questions so we can continue to improve our webinars. Don't forget too that we will be sending out to everyone attending tonight an exclusive discount code to be used on the Horseland website. On behalf of Horseland and Verbac, I'd like to offer a quick thanks to Dr. Tania and Kelly for their presentations and time tonight, but most importantly, a sincere thank you to everyone attending. Thank you again. I hope everyone here has a great evening, and we hope to see you again at a future webinar. Thank you.
Bye.